Welcome to Healing Horizons. I'm Chris Daniels, your host, and today's episode is Transformative Journeys, the healing power of Ibogaine therapy in Mexico. If you or someone you love is navigating addiction, trauma, or persistent mental health struggles, this conversation is for you. We will explore where Ibogaine comes from, what the science suggests, why many people travel to Mexico, and how safety, preparation, and integration shape outcomes. You will also hear grounded stories of recovery, guidance for families, and practical steps to evaluate clinics. My goal is simple: replace hype with clarity, and replace fear with informed, compassionate possibility. Ibogaine is an alkaloid found in the root bark of Tabernanthe iboga, a shrub native to Central West Africa. For generations, Bwiti communities in Gabon and Cameroon have used iboga ceremonially for healing, initiation, and spiritual insight. In the 20th century, researchers and seekers encountered these traditions, and by the 1960s, people noticed ibogaine's unusual effect on opioid dependence. Former heroin user Howard Lotsoff reported rapid interruption of withdrawal and reduction of cravings, sparking decades of curiosity, advocacy, and controversy. From there, providers, clinicians, and scientists began mapping protocols, risks, and benefits, bridging traditional knowledge with emerging biomedical approaches. What does Ibogaine do? Pharmacologically, it interacts with multiple systems, including NMDA, kappa opioid, sigma, and serotonin transporters, creating a unique interruption of withdrawal in many opioid-dependent people and reducing cravings across substances. Its long-lived metabolite, noribogaine, appears to sustain mood stabilization and anti-craving effects for weeks by modulating serotonin and other pathways. Equally important is the psychological window many report. Vivid, often autobiographical imagery and heightened insight that can reframe patterns, grief, and trauma. Taken together, the acute reset plus extended afterglow create a period where change feels possible, provided support and structure are in place. Where does the evidence stand? We have decades of case reports, observational cohorts, and a growing number of prospective studies suggesting meaningful reductions in withdrawal, craving, and post-treatment substance use for some people. We also have clear gaps: limited randomized trials, variable protocols, and heterogeneous follow-up. Ibogaine is not FDA approved, and it is not legally available for treatment in many countries. Outcomes appear strongly linked to context. Careful medical screening, competent dosing, continuous monitoring, and robust aftercare. When these elements are present, risks decline and benefits increase. When they are not, complications rise and gains can evaporate. So why Mexico? In Mexico, Ibogaine is not scheduled at the federal level, allowing licensed physicians and clinics to offer treatment within a medical framework. The landscape is diverse, from highly medicalized centers with cardiac monitoring and emergency readiness to smaller retreats with variable standards. Many people choose reputable Mexican clinics because they combine legal access, experienced teams, and costs that are lower than care in some other countries. Importantly, regulation is evolving and uneven, so due diligence matters. A strong clinic will offer pre-admission screening, clear protocols, transparent outcomes reporting, and coordination with your home providers for continuity. Who might benefit? Ibogaine has been used for opioid dependence, stimulant use disorder, alcohol use disorder, and for people caught in trauma-driven patterns that fuel compulsive behaviors. Outcomes vary by substance, history, and supports. Opioid withdrawal is often reduced dramatically. Stimulant cravings may soften. Alcohol-related patterns can shift alongside trauma processing. Yet Ibogaine is not a cure. Most people need continued therapy, community, and sometimes medications to sustain change. Plan for months of structured recovery after treatment. Expect setbacks to be possible, not inevitable. Approach Ibogaine as a powerful catalyst that opens a door you must walk through. Safety is the foundation. Before treatment, a thorough medical evaluation should include a 12-lead electrocardiogram, cardiac history, medication, and supplement review, basic labs with liver function and electrolytes, and assessment for seizure risk and psychiatric stability. Some clinics add echocardiogram or stress testing when indicated. During dosing, continuous cardiac and pulse oxygen monitoring, frequent blood pressure checks, and bedside supervision are standard. Medical staff should be present, not merely on call. Hydration, electrolyte management, and careful timing around recent substance use reduce complications. A conservative, stepwise approach to dosing lowers risk while allowing the intended psychophysiological effects to unfold. Contraindications and cautions matter. Significant cardiac disease, prolonged QT interval, uncontrolled hypertension, recent stroke, severe liver impairment, pregnancy, or psychosis generally exclude candidates. Many medications interact, especially those that prolong QT, slow heart conduction, or alter serotonin, including certain antidepressants, antipsychotics, antiarrhythmics, methadone, and some antibiotics. Benzodiazepine or alcohol dependence raises withdrawal seizure risk if not managed. Stimulant intoxication and recent cocaine use increase arrhythmia risk. Tramadol and bupropion can lower seizure threshold. Never abruptly stop prescribed medications without prescriber guidance. A competent clinic coordinates tapers or holds, monitors electrolytes like potassium and magnesium, and adjusts plans to individual physiology. Choosing well is pivotal. Ask, who is the medical director and what are their credentials? Is a physician on site during dosing? What monitoring equipment is used and what is the emergency plan? How many treatments have they performed and what are their outcomes and adverse events? Do they require ECG, labs, and medication review? Are detox and bridging supports available? What is the staff to guest ratio? Which aftercare options are arranged in advance? Red flags include pressure sales tactics, vague answers, minimal screening, and heroic dosing promises. Involve family early for education, logistics, boundaries, and support before and after. Preparation sets the stage. Begin with intentions that are concrete and compassionate. What patterns am I ready to release, and what will I practice instead? Under medical guidance, develop a taper or stabilization plan that minimizes risk and aligns with clinic requirements. Build a support team of therapist, peer group, and at least one accountability partner. Clean up sleep, hydration, and nutrition in the weeks before. Reduce stimulants and alcohol if safe to do so. Create a post-treatment calendar covering the first 90 days. Practicalities matter too. Travel documents, prescriptions, comfortable clothing, and a communication plan with loved ones. Dosing day is unique and demanding. After baseline vitals and final checks, you take a carefully calculated dose and settle into a quiet, low-light environment with continuous monitoring. Within an hour, many feel nausea, body heaviness, sensitivity to sound, and ataxia. The visionary phase can include vivid, often symbolic or autobiographical scenes, followed by reflective review. Time perception distorts. Most remain in bed, eyes covered, with minimal movement. Nausea and vomiting are common. Heart rate and blood pressure may fluctuate and are managed by staff. The experience often lasts 12 to 36 hours, with a fragile afterglow following. Integration is where insights become habits. Schedule therapy immediately after treatment, ideally within 72 hours, then weekly or more for the first months. Modalities like trauma-informed CBT, EMDR, somatic work, internal family systems, and mindfulness help translate revelations into daily choices. Join a recovery community, whether harm reduction, 12-step, SMART, refuge, or another fit. Map triggers and high-risk windows, and build replacement routines. Prioritize sleep, protein-rich meals, hydration, and sunlight. Some continue or begin medications for mood, sleep, or relapse prevention with their prescriber. Keep journaling. Protect this season from major life disruptions when possible. 2 brief stories. First, a 36-year-old father using fentanyl daily arrived terrified of withdrawal. With stabilization, cardiac monitoring, and careful dosing, He reported minimal acute withdrawal, life review, and a new grief narrative about his brother's death. He entered intensive outpatient care, joined a father's group, and at 9 months reports abstinence, therapy continuity, and renewed parenting. Second, a woman with long-standing cocaine use and complex trauma processed childhood scenes, then committed to somatic therapy and yoga. She relapsed twice early, learned new boundaries, and now tracks 90 days substance-free, sleeping better and working part-time. Many clinics honor a spiritual dimension, from music and intention setting to prayer or simple ceremony. This can deepen meaning-making, but it should be optional, respectful, and free from coercion. Remember Iboga's indigenous roots. Ethical practice acknowledges and supports Bwiti cultural custodians, avoids appropriation, and educates guests about history. Sustainability matters too. Tabernanthe Iboga is slow-growing and regionally threatened. Responsible clinics source pharmaceutical-grade, Ibogaine, or material from cultivated or alternative plants like Voakanga, and support replanting initiatives. Informed consent is essential. Clear risks, alternatives, reasonable benefits, and the right to pause or decline any ritual element safely. That's our journey for today. We traced Ibogaine's roots in science, weighed evidence in safety, explored why many come to Mexico, walked through preparation, dosing, and integration, and heard real recoveries. Remember, Ibogaine is a catalyst, not a cure. Outcomes hinge on screening, monitoring, and aftercare. For families, steady support with boundaries helps. Expect costs around $5,000 to $12,000 plus travel and aftercare, and plan medical clearance early. Use resources like ICEERS, the Global Ibogaine Therapy Alliance Guidelines, and national helplines. I'm Chris Daniels. Thanks for listening to Healing Horizons, and may informed hope guide your next steps.